Hello, everyone. We have some more people on the call, and I believe we can start. Um, Thank you once again for joining this meeting. This is the Career Day event hosted by the Institute of Health Research and Development, the University of Uyo Teaching Hospital. It is a pleasure to have you all here today to see our students, professionals, and our esteemed guests who have taken out time from their busy schedules to be here and to impact lots of insights and knowledge to us today. Today's session, okay, my name is Victory Ekman for those who were not here when I was introducing myself earlier, and I'm going to be moderating today's event. So today's session is not just another career event. We want to inspire, especially our students. We want to put in our students a drive to start thinking about their careers and to start making actual moves towards it. We are bringing together experts from different health fields, health-related fields, to share their experiences, to share how they navigated their careers, their insights, and I'm eager to soak up all this wisdom, and I hope that you are all eager to soak up this wisdom as well. But before we dive into the discussions, so we're going to have discussions from each of our guests, and then we're going to have panel sessions. So before we dive into the discussions and hear from our distinguished guests, I have to first of all invite the director of the Institute of Health Research and Development. It is my absolute honor to first invite Dr. Christy Akwawo. Dr. Christy Akwawo is a consultant public health physician and associate professor of global health. And she's a renowned researcher specializing in health management, health policy, and global health. She wears many hats. She's also the Deputy Chief Medical Advisory Council Committee Chairman for Research and Training at the University of Uyo Teaching Hospital, and serves as a key member of the Akwa Ibom State Health Insurance Board. Dr. Christy is passionate about health system strengthening, about research, about capacity development, about impacting and mentoring the young generation, which is why we are doing this today. And this has distinguished her as both an expert in her field and a mentor to so many. She has spearheaded critical research initiatives in Akwa Ibom State, including in the primary healthcare system. She has done work around infectious diseases, improving healthcare access through health insurance. And currently her work focuses on digital health, adopting digital health into the health system. And all this, she focuses on improving universal health coverage for everyone. So she is going to be giving us a welcome first. She's going to speak later and still share her knowledge with us, but she's going to be giving us a welcome. So please join me as I welcome my boss, my mentor, Dr. Christy Akwawo.
Thank you so much. Thank you so much, Dr. Victory. It's my absolute delight to be here. And I think I see that I don't really have so many people right now. I would solicit that you please put up the event on your social media platforms again to say it is now, it is time. So more people can join in. Then let me just go ahead to welcome all of us. It is with great pride that I welcome all of you to this special event organized to help our young students to illuminate their career paths within the health and development sector. On behalf of the Institute of Health Research and Development, University of Uyo Teaching Hospital, I am really pleased to see that we did send out an invitation to students, to mentors, and to professionals, and they have accepted our invitation. I say welcome, thank you. We are here to ensure that we support our students, and we are united by a shared vision of transforming lives through innovation, dedication, and service in the Institute of Health Research and Development. So this career fair, career and mentorship event is actually one of the mandates that we have in the Institute. Now, the health sector is not a standalone sector. The health and development sector, I like calling them together, is a very important sector. First of all, it demands technical expertise. So we must have people who have been trained as professionals in the health sector. But more than that, it requires compassion because you're dealing with human beings and human lives and people in their vulnerable states. It demands resilience. It demands a commitment to lifelong learning. So with this at the back of our minds, we recognize that the choice of what to do as a student and where you're going to be is very important. We recognize the profound impact your career choices can have, not only on your personal growth, but also on the well-being of yourself and the people around you, our communities, our nation, and Africa as a whole. We appreciate how important it is for you as students to settle into meaningful, impactful, engaging, and fulfilling careers. Besides the most important thing being that your career should actually ensure you are economically stable. Today's event is designed as a compass. It's serving as a compass because it's going to help navigate the myriad opportunities that lie ahead. There are so many choices to be made. What will I do? But we have a distinguished selection of facilitators and speakers, and they have come with a wealth of experience, insight, and practical guidance to share with you. They embody the diverse possibilities that are available as career pathways within the health and development sector, from groundbreaking research to frontline public health interventions, and from shaping policy and
So,
I think we lost her.
yes, I think we have lost her for a minute there.
Okay.
Let's just give.
innovating technologies and from community empowerment.
Yeah.
I'm sorry, Ma, we lost you for about 30 seconds there. Okay. Okay, I think we have lost Dr. Christy. While she comes back, just give her a minute to come back. Okay, sorry about that. Dr. Christy has faced some technical challenges and she will be joining us again shortly to complete her talk. So okay, she's going to join right now. Please let's give her a minute.
Hello, I am so sorry, I was thrown out. Hello, can anybody hear me?
Yes,
Yes,
we
you're
can
welcome
hear
back,
you
ma'am.
now. Welcome back.
I am so sorry, I was thrown out. So can I continue? Do I still have the floor?
Yes, please.
Yes.
Okay, all right. So as you engage in today's sessions, I encourage you to reflect on your strengths, your passions, and your aspirations. Think critically about the values you wish to uphold and the legacy you want to be. Ask questions, seek advice, network purposefully, and above all, please go back with a mentor. Remember that this event is not just a platform for gaining knowledge. We intend it to be a gateway to building relationships that could shape your career for the years to come. Let me also remind you that the health and development sector is rapidly evolving, driven by technological advancements, interdisciplinary collaboration, and the urgent need to address global challenges such as pandemics, health inequities, and climate change. This means that adaptability, creativity, and a global perspective are absolutely essential. They are not just options. To our mentors and our facilitators, thank you very much for generously giving us your time, your expertise, and your experience. Your role in guiding and inspiring the next generation of professionals cannot be overstated. To our beloved students, I commend your commitment to learning and growth. You are the future leaders. You are the innovators. You are the change makers of this health and development sector. So as we proceed in today's program, I hope you will leave here not only with clarity about your career options, but with a renewed sense of purpose and determination. Let this event be a stepping stone to a fulfilling career that would make a difference in your lives and the lives of others. Once again, welcome everyone, and I wish you an engaging, inspiring, and transformative experience. Thank you.
Thank you so much, Ma. Thank you for that energy-filling session. I hope that we have all been energized. We have gotten what it is that we have come here to do, and don't just take it as another event or seminar that you have come to attend. We have like key people here that, as Dr. Christy has said, you will learn from and get to network with. So as we move on to the next session, I would just drop some ground rules. Please mute your mics at all times. And if you want to speak, you could raise up your hands, but that would be at the end. So we are going to be taking questions at the end during the panel session. But for now, we're going to have our speakers tell us just a little bit about their career journeys, about themselves, about where they are at now, so that you can have a premise on which you would engage them during the panel sessions, okay? So we are going to be starting with Dr. Our great accomplished neurosurgeon, Dr. Ubon Ekpene. Dr. Ekpene is in the house. Yes, he is. So I'm so glad to have you here, sir. Dr. Ekpene is an accomplished neurosurgeon with a career in clinical practice and research. He holds an MBBCH from the University of Calabar and an MSc in clinical research from the University of Liverpool. He is also a fellow of both the West African College of Surgeons and the International College of Surgeons. He is a celebrated expert in his field and has made the news a couple of times. So Dr. Ekmene also serves as an honorary consultant, senior consultant, neurosurgeon, and the head of the neurosurgery division at the University of Uyo Teaching Hospital. In addition to his clinical responsibilities, he also lectures. He's a senior lecturer in the Department of Surgery, Faculty of Clinical Sciences, University of Uyo. So he has a wealth of experience in both neurosurgery and clinical science, and he's here as our clinical expert, our expert in the clinical aspect of health medicine, and will be telling us a little bit about himself, about his journey, his motivation, giving us a premise on which to engage him with later. It's my pleasure to have you here, sir. Over to you, sir. I'm sorry, sir, I don't know if you're speaking. Your mic is muted.
Okay. Can you not hear me?
Yes, yes, sir.
All right. Thank you, Dr. Ekmin. Thank you, everyone in the house. Thank you, Dr. Kwawo, for invitation. And thank you, students, for joining. I know this is for you, so I hope you would enjoy it. And I also hope that you challenged at the end and benefits maximally from the interaction. Okay, I can see Dr. Ekripo, I think, is in the house. I welcome Dr. Ekripo and every other person present here. I want to say in brief my journey so far. I would say that my interest in neurosurgery started in my SS3 secondary school. And how I got the interest was somebody gave me a book when I told a friend of mine that I was interested in studying medicine. And he said, "Oh, I have a book that interests you about a man. I've never heard him before." And he said, "I said, what book is that?" He said, "Do you know about one Ben Carson?" I said, "I don't know." He said, "Oh, that is somebody like, he has a book like that." And he brought the book to me. It was Think Big. And I collected the book, read it, and that was when I developed interest. I said, if one human being, at that time, I had never known there was a specialty, a subspecialty in medicine called neurosurgery. I had no idea, but that stirred up my interest when I saw what the man did with people's brains. So I said, okay, if I'm going to study medicine, then probably I should also look into that aspect. So that's where the interest started. And then I got into medical school and started studying medicine. I had great interest in anatomy. Anatomy was especially the gross anatomy was my favorite. I remember those days of dissecting and all of that butchering we were doing. It was fun. And that's where the interest began. And eventually culminating in my finish. I remember in my 5th year, or thereabout, one of the as students, which area would you want to specialize in? Many did not have any idea about me, which area they, of course, their interest was, let me teach medicine first. We'll talk about specialization later on. But at that time, I'd already made up my mind, told him I want to be a neurosurgeon. As at that time, there was no neurosurgeon in that hospital. No neurosurgeon. In fact, as at that time, I'm not sure we had up to 10 neurosurgeons in the whole of Nigeria. I never heard about them. I knew no neurosurgeon nearby. But just because of that interest,
Hello?
I think we lost him.
I think we're having some connectivity issues.
pardon? Can you hear me?
Okay, we can hear you now.
Hello? Sorry, I thought I was talking. I thought you could hear me all along.
Like
Where
30
did you?
seconds, we didn't hear you.
Okay, so did you hear me up to when I said I had a pediatric surgeon who asked us as medical students what our
Yes.
interests?
Yes,
Okay,
that's about the
so
time we stopped hearing.
uh, all right. Sorry, it's network. So when I told him I want to be a neurosurgeon, he looked at me cynically to see if it was something impossible as at then. And then they said, well, he wishes me luck. He hopes I won't change my mind later. And of course, when I finished medical school and started residency and finished my part one, because to become a neurosurgeon, Nigeria, you first have to finish medical school, finish your service as a case may be, start residency training. By December, I can hear noise at the background. Is somebody? Hello? Okay. So can you hear me? Hello?
Yes, please, we can hear you.
Okay. So you finished medical school and then you go for youth service, come back, start residency. You do a junior residency program, which you do general surgery and that subspecialty for 3 years. And after that, you get your part one. After your part one, you are expected to then proceed to a center where you can get training in a subspecialty that you are interested in, if it's not available at your center. So after my first training in general surgery, now I had to get a center to train in neurosurgery. And I had lots of delays. That was a point that I would say was a turning point for me, because at some point I was so discouraged. There were so few centers in the country to train neurosurgeons, and I had applied to a few I knew, and there was no space, no vacancy at that time. My teachers here were telling me, okay, why don't you change orthopedic surgery since you're having so much? I even went to the commissioners then, and he also said the same thing. Why don't you just do orthopedics instead of wasting away your years? And because my mind was made up, neurosurgery or nothing. I wouldn't, if I do orthopedics, I won't be satisfied. I will still feel that there's something missing, something I really wanted to be, which I didn't accomplish. So yes, it took me a long period of time waiting to get space somewhere. But God, in His mercy, helped me. And then a space I never expected opened up. That was in Accra, Ghana, Kolebu Teaching Hospital. And I went there and got training. So the bottom line here is that whatever you want to be in life, you begin to nurture it early enough. When you have that interest, when you have that conviction, you hold on to that conviction and run with it, because discouragement is definitely going to come along the way. But when you have set your eyes on the ball and you're focused and you trust God, definitely there will always be a way out for you to accomplish that desire, that expectation of yours. And it gives me joy today, because when I look around and see the lives that I have touched, I remember those days when I was in training, people with head injuries, brain tumors, children with deformities called spinal bifida, hydrocephalus, will see them and will just sentence them to death because there was no neurosurgeon around. Sometimes we refer those ones who were referred. Lots of them never got anywhere. Where's the money for them to travel as far as Ibadan or Enugu for them to get treated? So lots of them just decided to go back home, stay there, and either God delivers them or they die. And so when I saw all that, I said that something there to be done. That even spurred me up the more. And I can tell you that sometimes when there is necessity, you should look into that area, because that's where you may really create a niche for yourself. Don't always try to follow the bandwagon. Everybody's going into that area. Oh, there are lots of people there. Sometimes look at the area where people are not even looking at, and then you can, through that, shine. If I didn't do neurosurgery, probably I would have done orthopedics. And today there are many orthopedic surgeons. And probably the impacts I have created in my own little way today, I wouldn't have created it because others will overshadow my very existence or influence. But having that desire to look at where there was a need and went into that area of need. And today I can say that I have directly or indirectly, with the help of God, saved the life of hundreds of people that would have died with different neurosurgical conditions, the ones that have operated, then the ones that not operated, but of course, managing them, I can say they are in a few thousands that I have also affected in the few years that I have functioned as a neurosurgeon in this state. So overall, do I have any regrets whatsoever taking that decision to be a neurosurgeon and weathering all the storms of the training and the waiting and all of that? No regrets whatsoever. Instead, I'm full of praise and confidence and joy that it was worth it all. And probably later when I can talk about some of the cases that whenever I look back at, I say it was worth the stress. So I think my 10 minutes is up, so I'll just wrap it up. The way question comes, I can then respond. Thank you very much.
Thank you so much. Thank you so much, Dr. Ekpene, for that. That was very interesting. I wrote down a lot. I don't know if you guys were listening. I've gotten that we have to, okay, the thing I got the most is to not choose the path that everybody's choosing, or not because everybody's choosing it, right? But to try to have your goal in mind and then pursue it. Don't listen to naysayers or those that say it cannot be done. Thank you so much, sir, for that. And please, if you have any questions for Dr. Ekpene, please just write them down. You can put them on the chat. You can write them down, and during the panel session, which he's going to be there to answer your questions, you can then throw them at him. Okay. So we are going to have another distinguished speaker also give us a preamble into her career, where she's at, her motivations. We're going to be inviting Ms. Faith Nekabari Mfi. Ms. Faith is a senior program coordinator for the executives program at Africa CDC. She has over a decade of experience in public health program and design management. Her expertise spans healthcare workforce development, public health research, and sexual and reproductive health, and her focus is in Africa. She has served in several high-profile boards and advisory groups, including on the Global Burden of Disease Independent Advisory Board. If you know about GBD, that's a big one. The Africa Oxford Initiative efforts, WHO Technical Advisory Group on Applied Epidemiology Targets. Mfi previously worked with UNFPA, SRO, and the Center for Statistical Analysis and Research in Johannesburg, South Africa. She holds a master's in public health and demography from the University of Witwatersrand, and she's an executive MBA from Pontic School of Business and Technology. She's currently pursuing a Doctor of Public Health from the London School of Hygiene and Tropical Medicine, my alma mater. And she also holds a PMP Project Management Professional Certification. And it is my absolute pleasure and my absolute honor to invite Ms. Mfi Nekabari to this session to speak with us. Thank you so much. Okay.
Just checking that you can hear me.
Yes, please.
Can you hear me?
Yeah.
Great. Thank you. It's such an honor to be here today. And a very big thanks to my big sister, Dr. Christy, who we had previous conversations about this before I got invited. Lovely to also meet my co-speakers, and a rare privilege to be in your presence, dear students. As you've heard, my name is Faith. I currently work with the Africa Centers for Disease Control and Prevention at the African Union Commission in Ethiopia. just like you, I am Nigerian. I was a Nigerian student. My career started at the University of Port Harcourt, where I studied microbiology, which was supposed to be medicine, but those are internal family issues. But I ended up with microbiology. And then further after that, I progressed into public health, ran away from the lab again because of the sheer need for understanding more. I think I was spurred in wanting to understand the social determinants of health. I mean, beyond the pathogens that I dealt with almost every day at the time, culturing, isolating, etc. in the lab. What happens to the person when the disease organism is there? Beyond the medical lens, I wanted to understand the social components, which again are very much intertwined between the medical and the social. So that spurred me in chasing a master's in public health and demography. But demography brings in the social component that allows you to see beyond the case laying on your bed as a doctor, but seeing a human first, understanding the person's socioeconomic status and how that puts them in a vulnerable state. And then I moved from that to wanting to understand the business world. But you've heard my bio. What I'm trying to say is I was hungry for more. And being hungry for more, facing adversaries at an early age in my career, born and raised in Port Harcourt, there was so much that was standing in front of me as impediments. But as the previous speaker noted, I was hungry for more, and I didn't care about all the factors in front of me, being an orphan at the time with no parents, wondering who was going to pay my fees and how I was going to even, in fact, it was crazy to dream at the time, but I persevered. And one of the key things that my conversation with you today would revolve around a lot is perseverance in the face of adversity. So from there, I moved on, got a scholarship at the University of the Witwatersrand in Johannesburg. I moved and did my first master's there. While I was there, I wanted something that sets me apart. You know, a lot of times we think that when we have our MBBS, when we have our first degree, that is it. But the world has changed so much that what used to be the foundational stepping stone and the pedestal we needed some 20 years ago, some 15 years ago has changed. Right now, the pedestal and the bar has been raised so high. So basically, staying hungry is what will get you from point A to B. I moved then from having my first master's, and I also wanted to, put myself on a pedestal that singles me out at any point. And for me to do that, I was thinking, what are the additional skill sets at the time when I was doing my master's that were needed, that sets me apart as not just a public health professional, as one who understands the concept of health, but also as one who is marketable, who is employable, who has some rare skill sets at the time that is needed, to easily get into the space that I needed to be. Because as a child, watching the news growing up, I never really understood what the United Nations did. But a part of me was stuck on it, and I said I was going to work there. A part of me was like, whatever they do, I'm going to be part of it, especially UNICEF at the time, because I saw how, as a kid, I saw what they did for kids all over the world, and social media made that really, put that in the forefront. So that spurred me on. And at the time between finishing my master's, still waiting for my final results, I thought, okay, did a bit of a research, and I found that there are certain skill sets that are really needed at the time, the space of public health. And then that was for me M&E, monitoring, evaluation, and surveillance. And at the same time, geographic information systems, GIS, and spatial analysis in public health. So I thought, okay, in addition to my master's degree, my first degree in that time, who almost everyone had, this would really set me apart. And these are skill sets that I could really put to use and to give my CV the boost that it needed. So I thought, and again, I was doing this without guidance. I will talk about the role of mentorship shortly. I went in for it, did another 9 months of study while waiting for my results to be out and graduation. And then I got my certificates of proficiency in both areas. Then just out of the blues, one of those days, we had, just like this, a career day in my university then in South Africa. We had a couple of folks coming from all walks of life. We had people coming from the global health space, especially the UNFPA. I just spoke to a couple of us students, people who were doing their exams at the moment, people who had done their exams and literally waiting for their results. And then there was me, right, who also was on the wait list at the moment for my results. And a couple of us were picked to help then the UNFPA, the United Nations Population Fund, clean their data. Now, my choice of a master's, it's not the traditional MPH, which is, if you remember, I noted earlier that I was really bothered about how we were not, as medical professionals, not seeing the individual and the person in front of us. All we saw were the cases, the disease they were suffering from. But there's a human in front of us, right? So that pushed me a bit into having a mix of public health and demography. And demography really then forces you into sociology, the creation of knowledge, making meanings out of certain experiences, and how, as a medical professionals, you marry all of these different concepts to fully understand the person, the disease, and the combination of both, right? So we went in for data cleaning at the UNFPA office. So while we were there randomly, the director then just asked, oh, so is there any one of you who has any knowledge in monitoring and evaluation? A couple of my classmates then knew I was taking the extra course. They're like, oh, Faith had just finished the course. And then I was asked a few questions right there in front of everyone, what I could do and what I couldn't. And I was like, oh yeah, sure, I could do them. Now there's a lesson in there, which I'll talk about shortly as well. Then shortly after, another senior professional from the UNFPA came in and asked, oh, we're also looking for someone who can make maps. Anybody with GIS knowledge? Again, my classmates echoed my name, Faith. So it was quite interesting at the time because they're like, oh, you. And right there, he asked, what can you do with GIS? GIS was a new concept at the time, working with softwares like QGIS and ArcGIS, right? And then I said I could use both. Now, what I want you to understand here is I had this thing of never saying never, never saying no, because I think someone is speaking in the background. Just checking. Okay, thank you. I never said no because saying no is limiting oneself to the possibility and the vast world of learning, right? I knew that I could very quickly learn what the concepts were, even though I had just finished the certifications and I have not put them into practice. But I was seeing an opportunity in front of me. I never had an interview for that job. Right there, the questions I was asked, the fact that I was the only skilled person in the room at the time was my pedestal, was my opportunity, was my interview. I was told to start the next Monday. Although another pain point, which I want to highlight as well, is paying the price. So I started off as an intern. And then at the time, the UN never pays their intern. So here, a student in a foreign country waiting to get my results, not gainfully employed, and now I have to work within the UN structure, which I've always dreamed of, but as an intern without pay. A lot of us would have walked away from that opportunity, especially in today's world where we understand the difficulties of even navigating from your house to the office and doing that for so long, over a couple of months, without any remuneration of some sort. So that was quite challenging. I had an internal battle with where I was thinking maybe I should just say no. Once my results are out, I'll possibly get an employment where I can be paid. And that's it. I mean, what's the point suffering here in the UNFPA? But the fire in me kept burning. And I was like, oh, Faith, this is your prize. This is your prize because at every step of the way in our lives, there are prizes. Something will give. At the moment I was giving my comfort, at the moment I was giving off the fact that I was not being paid, right? And then I started working. 1 month into the job, I got an offer within the institution because they could see what I did over the short time. Should I have walked away and gotten another employment somewhere, that would have still been great, but that would have shifted me away from the path to my dream. So I think that's important to note. I continued there, and the African child in me wanted to give all of that knowledge back to Africa. The UN, of course, as you know, is a global North institution. So shortly after that, I got a call. Again, another point. I had progressed in the UNFPA, and I was earning good and properly satisfied. But then there was a call to go serve and give back that knowledge to the African continent, which again was going to be a pain point and a point of making a significant sacrifice, because I was going to take a huge pay cut. But then the most important thing to me is, at the moment, was my personal convictions of how Africa could grow as a continent and how far behind we are. And working in an environment that exposed me to the racial biases of knowledge and dealing with people who, just by the mere color of your skin, deem you to be less knowledgeable. So all of that stirred up a certain desire in me and continued to fire me on. And we moved to the African Union, the Africa CDC, as a volunteer again. And of course, shortly after that, rose in the ranks. But what I'm really trying to point here is, I think in our current world today, we sometimes get swallowed up in the idea that you get out of school and life is going to just be like this and life is linear, but it is not. What I'm trying to say to you right now, and what you would hear from a lot of the line of speakers, is open your mind to the world of possibility. Open your mind beyond the world of medicine. Medicine is great, but there's so much more that makes you a fine, refined doctor. There's so much more. If you ever envision yourself leading these big multilateral institutions, you're going to need a lot more. Dr. Christie here is an example. She was part of the cohort of the Kofi Annan Global Health Leadership, one of the initiatives that I developed in the Africa CDC. And we wanted to bring together a group of high-level senior public health professionals in Africa who are contributing their different quotas in, building the continent that we want, in contributing to improving Africa's health outcome. But I think she did that, understanding that where she is, being a refined and a renowned and astute medical doctor wasn't enough, and she's leading, holding leadership positions. So the ability to come out of that space and recognize the gap, and then finding important skill sets that fits that gap, is important. Coming back home, I know that it's hard. I know that it proves difficult, but trust me when I say that it can be done. Trust me when I say that those barriers can be broken. Sometimes we sit and we're only able to see the cloud in front of us, but it takes a lot to open your mind, and that's where mentorship comes in. Personally, I have benefited from a lot of unstructured mentorships, because I know I have not had like a very structured one-on-one mentorship as it is textbook-wise, but I've had very senior, very great global health professionals who have advised me, who have steered me and walked me through my trajectory from where I started to where I am. And I think that will really be important. As I've promised to Dr. Christie, that's one of the things I'll be willing to do for some of the students here. But I'm begging you to open your mind to the world of possibilities. See beyond yourself. One of the things I like to tell myself is I am a culmination of my decisions, right? Every decision you are making, you have made, you are currently making, and you will make in the past, will all aggregate into the person that you are. So it means that everything you do on a daily, it builds, it adds into this bigger picture. So I want you to think about that and live your life very intentionally. Draw up a plan. It may not be as amazing as you want it to be, but start somewhere. Draw up a plan and make sure that everything you do every day links up to that plan. Look at it from 3 different points. From personality-wise, do I have the right persona that allows me to do this thing that I want to do? skills wise, do I have the right skill sets? Am I on the right trajectory, the right path? What do I need? What is lacking? Your ability to self-critique would be one of your greatest weapon in walking this journey. Your ability to self-critique, your ability to remain teachable. None of us know it all, right? Your ability to stay humble, remain teachable, and learn, find learning opportunities in everything and anything. I think that will be most critical. There's so much I'm going to say, but I think I'll pause here so that I don't eat into the time of the next speaker. But I'll be happy to take your questions. I'll be happy to engage you further and work this journey together. Thank you so much, and back to you, Victor.
Thank you so much. That was very interesting, very insightful. I took a lot. I've learned to stay hungry, be hungry, right? This, I'm not a student, but this is very, I wrote down a lot. Stay hungry, to be hungry, to build skills. So you said stuff about, you built skills, and then when the opportunity came, you were ready. So I'm hoping all of you are hearing this, to even from the level that you are at, it's not too early to start. It's not too early to start building skills and start building things such that when opportunity comes, it meets you at that point, right? Thank you so much, Ma, for that opportunity, and we hope to engage you later. So now we have another distinguished guest in the house. We were supposed to have two guests holding the session, but one guest could not make it. Still, we are very happy to have Dr. Godsent on the call with us today to speak as a young professional and as a health tech expert. So Dr. Godsent is the CEO, Ndoma. Dr. Godsent Ndoma is the CEO of Zion Tech Hub and the co-founder of Medics in Tech, where he leads transformative healthcare initiatives across Africa. He's very passionate. He's a healthcare analyst dedicated to transforming Africa's healthcare landscape and Africa's healthcare landscape through data analytics and predictive modeling to address healthcare challenges and improve health outcomes. Through Medics in Tech, is the organization he co-founded. He has empowered lots of healthcare professionals with digital health skills and bridging the gaps between technology and healthcare. Godsent is also dedicated to mentoring and inspiring future healthcare leaders to embrace technology for a healthier Africa and beyond. So Dr. Godsent is our health tech expert, and I wanted to bring this perspective because the future is tech. So please join me, as it's my absolute pleasure to welcome Godsent, please. Thank you.
All right, thank you so much. Please confirm that you can hear me.
Yes, we can hear you.
All right, I'm really excited from what I've heard. Honestly, if we stop this webinar now and go home, we have gotten a lot. We have gotten everything. Yes, I was listening to Miss Fitz and I was having goosebumps all over me. The reason is because we share a very common history, right? I lost my father when I was 4 years old, and since then life was really, 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 I don't know the right word to use, but life was tragic, you know. And then I went into medical school, Dr. Nnamdi Azikiwe University in Oka, and all the whole financial demands on medical school, you know how it is. My mom was just a petty trader, and so it was really difficult. In fact, just like her, I had to fend for myself. So at the time in medical school, I was doing something called house cleaning. So I used to, when my friends rent an apartment, I'll go and clean it for them, and then they'll give me 3,000 naira, 4,000 naira. That was how I was able to survive until it shifts, which is what I'm going to talk about. I want to appreciate Dr. Christine, the director of the Institute of Health Research and Development Council. Thank you so much, ma'am. All right, it's really an honor to be here. Now, this is the thing. I'm going to be telling you practical sections. Everybody who has spoken have spoken so much. I've given us so much knowledge. I'll just be telling you my stories, which outline to every single thing that they have said. Right? Let's start with Dr. Ubon. He said he's a neurosurgeon. I also wanted to be a neurosurgeon. I read the book Gifted Hands by Ben Carson, and I said, oh, I'm going to be a neurosurgeon. And then eventually I got into medical school and realized that I wasn't really as passionate about it like Dr. Bong. Dr. Bong said it was neurosurgeon or nothing. I was not like that. So I started looking at, but there was something that he said that is very unique for me. I started looking at gray areas, right? Gray areas where we could make an impact. Very important. And then I started looking at some gaps. Now, let me tell you why this happened to me. Do you know how my dad died? He had an accident and then he was rushed to a particular hospital. And they said, oh no, we don't have space here. And then my mom said as we were rushing him to another hospital that he gave up the ghost, that he died. And then I was thinking to myself when I went into medical school, I saw a lot of situations like that played out over and over again, where we bring patients and we're saying, oh, there is no space for them. Oh, can we take them somewhere else? And I have watched before my very eyes, these patients have gone. So can we create a system where we don't have to do trial and error, go to hospital X and they are telling us that no, there are no hospitals, there are no space here for them, and we go to hospital Y and they're telling us the same story. And then, when patients are in this kind of situation, every single second counts, right? So can we create a system where we are just so certain about what we are doing now? We know that, okay, as we are getting to this hospital, that there is a place for these patients to receive attention. That's what's happening in the Western world. And so I started thinking outside the box. And most importantly, I was beaten by pain, right? I was, there are two things that actually will stir you up after this conference. Everything you've heard has inspired you, but there are two things that will spur you up to start pushing for success. People don't become so intentional about success until the pain of failure becomes so unbearable, right? Or they are driven by vision, they are weakened by vision. When you're weakened by vision and you're like, okay, we can get this done. So in my 400 level, that was when I started looking towards tech. Yes, my 400 level. And I know a lot of you right now are in medical school and you'll be saying medical school is so hectic. Are you sure I'm going to have time to do something else? Yes. Now, for you to be successful, like Dr. Faith, like Miss Faith, you're listening to her now and you're like, I'm going to be like this lady. For you to be outstanding, right, you have to be a little bit more than everyone else. Yes, you have to be a little bit more than everyone else. So when everybody else is doing the normal second MBBS, you're struggling to write second MBBS, struggling to write MBBS, and all those hectic things, behind the back end, I was learning data analytics. Yes, everybody was, I was still doing everything that everybody was doing. But success demands that you are a little bit more than everyone else. That's how to become outstanding. And so I was taking a course in data analytics. And then I was connected to a mentor, Professor Joseph Nwobodov in my university. He's also shared very similar, he's a veteran like Professor Christine here in the public health space. And so he connected me with a mentor in the UK who actually started training me in data analytics, data science, and predictive modeling. And so while everybody else was doing the conventional thing, I was also doing the conventional thing with them, the pathology, the pharmacology, and all those things we're doing. But at the back end, I was taking courses in data analytics. I was taking courses in data science. I was learning Python. I was learning machine learning models, DevOps and all. And then my mentor told me and said, see, God sent, you have to go up on LinkedIn. Right now, we have talked about mentorship. And then I guess there are very few experts here. We are not even up to 4. And we can't take all of you because there are about 40 of you on the call. And some of you will be asking, how do I get other people to mentor me? If you go on LinkedIn, you're going to see a lot of them. If you attend conferences, you're going to see a lot of them. Now, there is one mentor that has absolutely transformed my entire life, right? Because I don't really have so much experience. You see, when they were introducing me, they didn't say PhD is also and so from Liverpool, Masters in Manchester, like we have all seen from other speakers. I just graduated from medical school recently. In fact, I'm doing my house job, right? So I don't have all those things. But let me tell you what I've been able to do. In my 500 level, I got a remote job from Project Group. So currently, I'm working remotely for a US-based company, Project Group. And what my company is all about is providing medical interventions to countries that are displaced by insurgents, affected by disease outbreak or natural disaster. And currently, we are in Gaza. So we are providing medical intervention to the people in Gaza. And we are considering providing medical intervention to DR Congo, where there's currently an Mpox virus. And we are currently evaluating the data. I had a call yesterday with our consultant who is currently evaluating the data from DR Congo to see the spread of the Mpox virus and see how best we can approach our intervention. Now, I got this job in my 500 level. Yes, right? And for the first time in my life, there are some things that seem not possible until they happen. And so Faith has said something, Ms. Faith has said something very important, that you have to open your mind to the world of possibilities and think outside the conventional medicine. I don't want to see things outside medicine, because what we are still doing is medicine, right? I didn't know that digital health is also a specialty in medicine, right? So if I ask some of you now to mention the specialties in medicine, you're going to see the conventional things that you know, cardiology, neurology, and less. But digital health is also a specialty in medicine. So we are not asking you to look outside medicine. We're asking you to look at the broader spectrum of medicine and everything that it encompasses. And let me tell you something. We want to become like the Western world, right? We want to become like our counterparts in Europe and in Asia who are doing amazing things. But we have to also understand that the foundation for that revolution, that healthcare revolution, is research and innovation. Research and innovation. And so if you're not researching, if you're not innovating, and then everything that we are thinking about is going to be a mirage. And every single one of you on the call listening to me right now, you have a role to play in redesigning our healthcare system and ensuring that it becomes what we are envisioning and what we want it to be. And so we that are very young, Dr. Kristen very soon is going to get retired and go and spend vacation in one beautiful island. So we are the ones to redesign and redefine our healthcare system. And so the burden falls on us. And so you have to start taking the skills now. You have to start learning now. So right now we are doing predictive healthcare analytics. We are looking at patient data and we are tailoring healthcare specifically to meet their needs. We are analyzing genomes, right, to see how patients which kind of diseases patients are likely to get. I don't know, Dr. Victory was in the call with my mentor, Dr. Sonia Beneme, is the East Africa, East Asia director, regional director at UNICEF. He was talking about a very novel project I'm currently working on. So I'm currently working on a predictive model that is able to predict patients vulnerable for diabetes, hypertension, and cardiovascular disease. We are working with a large ton of data to build these models, right? And this project has gained attention at the UNICEF level. So irrespective of where we are, from a small village in Uyu, from a small village in Oka, from a small village wherever we are in Nigeria, we can create impacts that resonate all across the world. And so as I end this very short introduction, I want to tell you one thing that stands out. One thing that stands out is right now, start from where you are with what you have, doing all you can. The time is never going to get better. Start learning that skill now, right? Start seeking for mentorship and guidance from industry experts who have gone ahead of us. And most importantly, start putting yourself out crazily. Faith said something that when it was asked in class, who has done monitoring and evaluation, and our whole class said Faith. It was asked again, who has idea on GIS, and everybody said Faith. That means that when she was taking the course, she was telling her friends that, oh, I'm doing this course, because if she was just in her closet, in her room, taking this course, trust me, her friends will not know. And maybe when she got the certificate, she posted it on her status and shared it on LinkedIn and said, oh, I just got a certificate in monitoring and evaluation. And that was why her friends knew that she was taking the course. And that was why they recommended her for those opportunities. And so when we begin to learn new skills, we have to be so aggressive about it. We have to put it on the faces of every single, in fact, if you can write it on your head, if you can write it on your forehead, please do that. Because most importantly, it's not about how valuable you are. It's about how people perceive. See, becoming an expert is one thing, and becoming a recognized expert is another thing, right? And a recognized expert is people that people can mention everywhere and say, oh, you want to do this, go and meet XYZ person. You want to do this, go and meet XYZ person. And so as we close this section, I want to tell you that the future of healthcare is digital. Just like everything we have known, the future of healthcare practice is digital. And if you're not thinking digital, then you are, I don't want to say you're in the 1999, but thank you so much.
Thank you so much. Thank you so much, Gotens. I knew you were going to say that. That's why I said it initially, that the future, that you are the digital health or the health tech expert, and everything is, future forward health tech. Thank you so much for that beautiful session. You've said, there's something you said that starting now, starting where you are at, that's how you put it, starting where you are at with what you have and putting your all in it. And I really resonate with that, because one of the things that birthed this program was the fact that lots of people in the medical and health field come out of school and only have done school, but their counterparts in other fields have done other things. And in today's world, only doing school is not enough anymore. I'm sorry, it's the truth. In the world we are in now, and school is very important, but by the time you are done with school and maybe you didn't want to tour the very traditional path and you want to do something, and they say, oh, what have you volunteered in? they will always ask you, what have you volunteered in? What did you do? What did you assist in? And then there is nothing. So Dr. Gossent has told us, do something, start now, start where you are at. And so that you can have a longer future. So we're going to take a 5-minute break before we bring in our very esteemed Dr. Kripo, my own teacher. We're going to have a short 5 minutes session. I have put in a link on the chat box to a question. Just kindly answer the question, and I'm just going to share the answers to the question. It's a simple question that, I don't know, can everybody see the link? Can everyone access the link? Hello? Please just let me know if you've been able to access the link and answer the question. This is one of 2 questions, and we'll just... Okay. Okay, and I have put the link to the second question as well. The link is on the chat box, please. Okay, so we've gotten some votes from the audience. We have about 11 votes so far. And wow, this is beautiful. So the question said, do you know what you want to do after school? And majority of people have a very clear career path, and that is something that is very admirable. Wow. So just looking, sir. Okay, so let me just state what we have. Currently, 59% of the people have said that they have a clear career path on what they want to do in life. And this is followed closely by, okay, not closely, this is followed by 28% of people who just want to be rich. Thank you very much. I too just want to be rich. And then, okay, that's not true. And then we have 11% of people who are not so sure. Who is that showing life? That's okay, that's understandable. That's why we are in things like this. You have time to choose, and there is no time limit. It's just to always look forward and take a step in the right direction or in a direction at every particular point so that you can be moving towards your goal. And we have people who say it changes every 3 months, which is about 5% of the people on the call. That also is very understandable at this point. I would say to do more research. I mean, our speakers are here to tell us what to do to be able to figure out that if your goals are changing every 3 months, that must be exhausting. I'm sorry. Okay, and then the next question, this is a question that is always asked almost every time on social media. You know, all those people that do podcast, no, not podcasts, like they just go to the street and then ask people questions. Like, so if you have to have a dinner with Jay-Z or $10 million, which one would you go for? So I decided to ask the question just as an icebreaker, and this is amazing. So 50% of people says, give me the money. However, 44% want to have a dinner with Elon Musk. Wow, that is beautiful. Actually, now it's 50-50. Now it's 50-50%. So I don't know what I would really, really love to engage with anyone that wants to have a dinner with Elon Musk to find out why more, because I would go for the money. But yes, thank you so much, guys, for that session. And I'm just going to close the poll. Thank you. So we're going to be moving on to the next session, which we're going to be bringing in another clinical and academic expert, Dr. Udeme Ekripo. Okay, Dr. Ekripo is on the call, yes. So Dr. Udeme Ekripo was my teacher, my beloved lecturer. He's a senior lecturer at the University of Uyo and a consultant nephrologist at the University of Uyo Teaching Hospital in Nigeria. He serves as an adjunct senior lecturer in clinical epidemiology as well at the University of Calabar. Dr. Kripo holds a doctorate degree in nephrology from the University of Cape Town, South Africa, and an MSc in epidemiology and biostatistics from the University of Witwatersrand in South Africa as well. His medical degree was from the University of Ibadan, Nigeria. He is also a fellow of the Medical College of Physicians, Nigeria. Dr. Ekripo is a pioneer in nephrology. He has won so many awards. I remember as a student, I was usually very fascinated by all that Dr. Ekripo was doing. He established the renal replacement therapy services for patients with end-stage kidney disease in Akwa Ibom, reaching over 6.4 million. He is a pioneer in his field. He is widely published because he's here today to speak to us about academia, mixing academia and the clinical sector and laboratory sector. So he is very widely published in high impact journal and serves as a peer reviewer for several reputable academic journals. Dr. is passionate about health research, capacity development, and he teaches epidemiology and biostatistics to health researchers. He currently works at Davita Healthcare in Saudi Arabia and continues to contribute to nephrology and academia and the research space. So please join me in welcoming our esteemed guest, Dr. Udeme Ekripo. Thank you.
Okay, thank you, Victory. Can you hear me? Kindly confirm.
Yes, we can hear you. Thank you.
Okay. Thank you, Dr. Akwawu, for asking me to share my short life journey. And I want to also recognize people who have spoken before me. I was quite fascinated with what Faith discussed, and everything she said is actually true. Thank you, Dr. Ekbene, not just for your talk today, but for how many people you've helped. I still remember all the calls that I kept making to you to come save this life and come save the other life, and I'm still very grateful. First of all, I left Saudi. I'm now in the US with the Division of Nephrology, University of Alabama.
Oh, okay.
At Birmingham. Like God Sent had said, we had really humble beginnings. My parents never went for any formal education. My dad was a successful businessman, but then he went into politics and everything got destroyed. So we went to school having a lot of hard times. So I got admission into Ibadan to do medicine, and at that time things were really tough. But what helped me was that by the end of my first year in school, I got a mobile scholarship. And that's what I used to send money home, buy the few books I could buy, feed myself for 1 year, pay my school fees. So I started selling CDs of books quite early. And even when I was in secondary school, I used to travel from Ikorekone to Aba to buy books to sell in Ikorekone and buy wristwatches to come sell in Ikorekone to make some money. I have sold I've sold moi moi, I've sold fried meat, I've sold rice, just to encourage someone who may be going through some tough time. There's nothing God cannot do in your life if you could stay focused. I finished as best in medicine in UI in 2002, even with all the tough time. And then did my house job in UI. And I wanted to be a thoroughbred physician. But then things changed when I was doing my residency. At that time, University of Uyo Teaching Hospital did not have accreditation, so I had to go back to my alma mater, UI, for residency. And after part one, I came back to Uyo, and I remember having to do the extra work. And this is one of the things, again, Faith had mentioned this. Dr. Ekpene had also mentioned it. Whatever your hand findeth to do it with all your heart. So by 12 midnight, I'm not on call. I'm still working in the hospital. And I didn't know that the CMD then had noticed the extra work I was putting in. So after I passed part one, I was working on the corridor of UUTH. And my friend who had just become a mister in the UK for ENT surgery. In fact, he is one of the robotic ENT surgeons in the world now, called me and said, Bishop, I'm now Mr. Olaleye Oladejo. And I told him, thank you very much. Okay, I've passed my part one and I want to come to the UK to do a master's in nephrology in Sheffield. And he was encouraging me, and unknown to me, the CMD was walking behind me. And he just taps my shoulder and tells me, see me in my office. Oh my God. So I get to his office. At that time, people were using BlackBerry. So he gave me his BlackBerry and told me, apply for that master's program. And I looked at it and I saw South Africa. What would I be doing in South Africa? And then I wanted to go to the UK. I wanted to go to Sheffield, do a clinical master's and really do something in my mind I thought big. And I told him I'm not interested in doing epidemiology and biostatistics. He collected his phone from me and walked me out of his office. I really didn't care. 2 weeks later, I see a foreign number calling my line, and I picked up the call, and it was my CMD. And he tells me, I'm giving you an instruction. Apply for the epidemiology and biostatistics masters now, and it's not up for debate. So that's how I got to WITS, and I'm glad to hear that Faith also attended WITS and did demography. I also did some courses in demography at WITS. So, and I'm almost sure we had the same teachers. So I got to WITS and it was interesting. And that was where the turning point in my career actually came. Because with what I was taught in epidemiology and biostatistics, I really started writing a lot of papers. And then I came back to Nigeria, helped set up 2 or 3 dialysis centers, did another course in healthcare and hospital management in Singapore. And because I thought I should really make a change. But when the politics of Nigeria didn't allow me to make the changes I wanted to make, and I wasn't ready to steal the monies people wanted me to steal for them. I thought it's time to leave Nigeria. But before then, I had gone back to South Africa again to do a PhD in nephrology. And that was a tough time in my life because I spent more than 20 million naira of personal money just to make sure I was able to pursue what was on my mind. And did it make a big difference? Yes, a real huge difference. Because before I finished that PhD program, that's when I got an award as an International Society of Nephrology Global Kidney Health Atlas Fellow. And then as I was finishing the program, I got another award as an emerging leader in nephrology from the International Society of Nephrology. And that changed my life, got me in contact with the who is who in nephrology globally. In fact, I have been able to sit on the same panel with the people that wrote books like Harrison to examine PhD at the University of Bristol and the University of Cape Town. So when you do have a passion, be ready to give your all to make it come to pass. So I left there, I went into industry. I worked with Davita. Davita is one of the biggest nephrology multinationals. And I saw what the business of healthcare looks like before I moved from Saudi Arabia, where I was the research lead for Davita to the US. It looks a little windy, but it has really been fulfilling. That is what my journey has looked like. Before I stop, I'll just tell people, if you are pluripotent like me, I mean, you are anything that you set your mind to do, you can do very well. You will be confused about what to do. So let God lead you. I've also been able to stand on the shoulders of a lot of mentors, and like the former CMD, Professor Emmanuel Ekanem, who actually paid for my master's, and that changed my life, gave me a more global outlook of what medicine looks like. I would just encourage you, you really have to develop yourself. You really must develop yourself. Even after my PhD, even after becoming an associate professor, I went back again to do a second master's in data science and started building the kind of models that God sent builds. In fact, recently I was able to build a model that would be able to predict dialysis individuals who are going to have their AV fistula or AV graft close, and therefore increase the risk of dying, which is something Davita in Saudi Arabia is going to be using in the months to come. I built that before leaving them. So I went back again to do a second master's, even after my PhD, even after becoming a professor. I went back again to do a second master's in data science. Then I went to MIT to do a program again in data science, really because I really wanted to be good at what I do. So you can push yourself to the limit. You really have to. Before I stop, let me tell you, seest thou a man diligent in his business, he will stand before kings. He will not stand before ordinary men. If you really work hard in what you do, anything committed to your hand, you will see a lot of increase. And I need to also mention that money is absolutely important. You must be rich. You must have a lot of money. You have to learn the business of healthcare, which we will discuss as we take questions. And you also have to think of making money even outside medicine. If you make a lot of money, you are able to do the things you want to do. And that's what helped me. I could go to MIT because I now had money to go to MIT. So think about that. And don't limit yourself to traditional medicine. I have a mentee, his name is Udeme Nelson. And each time I talk with him, I know he has a very big future. He's a physician, but he's also gone into data science and he's learned Python. I learned Python late. I learned R late. I went to learn Python. I learned R. I learned the data visualization softwares. I went to do Microsoft Azure all over again just because I really needed to reinvent myself. So do your best in everything you do and make a lot of money and make the money early. Thank you.
Thank you so much. Thank you so much, sir. Thank you for that incredible session. And yay, Udeme. Udeme is also here and is part of the planning for this session. So thank you so much. Just so that we can hurry up to the panel session, I'm going to be inviting Dr. Christy. As I said, she was going to speak again. So I have already previously introduced Dr. Christy, but Dr. Christy is going to be talking to us this time around about beginning to build your profile while you are at this level in order to be able to make impact in future. So please, once again, join me in welcoming my own mentor and my boss and my teacher, Dr. Christy Akwawo.
Okay. Thank you very much, Victory, once again. I must say I am inspired to be here. I can only imagine what the students are going through because listening to this amazing mentors here, I am totally wowed myself. So I'm not going to spend so much time on myself, but I will just say a few things that have allowed me to be where I am. Unlike Dr. Obongekwene, who had clarity as to where he was going, I didn't have that clarity that early, but clarity has come in different moments. My aha moments have come. So, for example, what really shaped my choice of public health as a career was that I wanted to be available. I wanted to be home. I wanted to be available for my kids. I didn't want to do core medicine that wanted me to be going to take calls every day. To be sincere, that's what started me off for public health. I didn't think I was going to do public health as a student. No, I didn't think of public health. But when I now made that decision, I said, oh, I wanted to be home. I was married to a husband who was going to be offshore for a long time. I said, okay, let me be home for these children. So I chose public health. And when I went for an update session, I knew that this was the place I was going to be. And another thing was that what resonated with me when Faith was speaking is the need to stay hungry. Stay hungry. I have never thought of being a medical doctor, just being in the office, just seeing your patients and all of that. I always desired to be that professional that was able to make a difference. That has always been me. Call it ambitious, call it whatever name you're going to call it, but that was the fire that was burning in me. And that's what defined and made me go ahead to do my primaries when I was yet a house officer and, taking care of my children and my family at the same time. So my own journey was tempered by being domesticated. I wanted to be available. Unfortunately, by the time I entered public health, I knew I had to travel a lot. I had to travel a lot. So that my idea, I couldn't really, have it the way I thought, but I have absolutely no regrets. Now, another aha moment came to me when I was in a conference, a medical women's conference in Germany. Now, I had Professor Ilona Kik speak to us. And when I looked at her, I was like, oh my God, this is global health. That was when I said I was going to be a professor of public health. This was in 2008. I wrote that down. And today, I have become a professor of public health. Well, my full chair is yet to come. But that speaks to clarity again. I didn't know exactly where I was going, but the aha moments came. Okay, so that is the way I wanted. And for me, I have never really vied for anything. But God brings these things to me. I believe in the God factor. So as a young person, I would say, entrust your life to God and serve him the best way you can. Just give God a place in your life and he will align things for you. So that's it for my own journey. I have been an academic and I see that my own role has been to inspire the students, inspire the next generation. And I tell people, I am in competition with no one but myself. I desire every day to be the best version of myself. So that's why I learned the skills. Faith said it. I always ask myself, what do I need to do in order to stay relevant in the contemporary world? I have moved from being in health insurance. By the time I went to London and all we did was universal health coverage, health insurance. That naturally made me a universal health coverage advocate. But I have realized that the future is digital. The future is digital. So I have also gone into digital health. Somehow, I think it's God also just aligning things for me. So yeah, that's the way to go. Victory says she wanted me to speak to, personal branding. It's important as students to be very intentional about building your brand. And I also tell students be very cautious. Be cautious with social media presence because anything you put online, you cannot retrieve it. It sticks with you. Be cautious with whom you accept as your friends on social media and Facebook, okay? And so when you're trying to build your personal brand, yes, it's important to identify your niche, identify your passions, tell your story as authentically as you can. If you can create a professional blog that you can maintain, that will be fine. But claim your social media profile. Be very careful about what you put online because it will remain there. The internet never forgets. And if it's possible, please, as much as you can as a student, sign up for mentorship forum like this, and then network and collaborate. Any conferences taking place around you, please sign up for them. Volunteer. Volunteering is also another way that you're able to get people to develop your skills, and you get to meet people and you get to identify what your interests are, where your passion lies. And try, please, to set goals for yourself. If you write down what you are thinking, it becomes a clearly defined goal. But if you're just thinking it in your head, it is not a goal, right? So you need to be able to discover your personal unique goals and also try to follow through on them. And then it's important to have what I actually define as sessions, reflective sessions with yourself. you can write down the kind of things you're interested in, what you want to do. By the time you come back to them 5-10 years later, you'll be surprised. You have actually done what you set out to do. It has happened to me a lot of times. So learn to journal. It's very good for you. And then when you attend conferences or events, network and collaborate. Don't just go and sit in one corner to yourself. No, please. Talk to people, introduce yourself, listen to people, and work on projects together. Someone says they want to write a paper, please get interested, co-author, all right? Or you seek guidance. Tell people you want to be mentored. And then when you are done with an event, like if there is a conference you've attended, please don't go and sleep in your corner. Send a message to the persons you have met. Ask, do a follow-up. Tell them, oh, it was nice meeting you. I'm interested in this, and follow up. Just follow up. It's very important. So these are the few things I would like to, just let us know for purposes of this event and for time's sake, so we can go on to the next session, the panel session properly. Thank you.
Thank you so much, Ma, and I'm very proud. So that is my mentor, everybody, and that is one of the reasons why I am progressing. So thank you so much, Ma, for that session. One thing I really picked out was the balance between having a focus and being flexible, and looking at those aha moments and picking them. So thank you so much for that. So we're going to be going straight into the panel session. Our distinguished guests are here to answer questions. You have a burning question about your career, you have a burning question about where to go next, please put it in the chat box. Or you could raise your hands and then we could ask you the question. You could either throw the question to everyone, or you could direct it to any of the panel speakers that you particularly have an interest in. To anchor this session, two of our my colleagues at the Institute of Health Research and Development are here. We have Dr. Teresa Nde and we have Juana Fabian, and I'm going to be handing over this session to them shortly. Please put in your comments in the chat box. We are monitoring it and we're going to ask your questions and comments. And thank you so much, our panelists, for agreeing to answer all our questions. Thank you. Over to you.
Hello. Hello. I hope everyone can hear me.
Yes, we can.
Okay. Good. Oh, someone has unmuted. Okay. So good afternoon, everybody. We're going straight to the panel discussion. My name is Dr. Teresa Nde, and I'll be anchoring this session with another of my colleagues from the I'm going to be anchoring this session with Juana, another of my colleagues from the Institute. So I'm going to go straight. I've seen some questions in the chat box. So I'm going to bring up your questions as time goes on. So please bear with me. So I'm going to go straight to Miss Faith. And I would love to ask, I listened to you speak, and I'm sure most of the audience are also waiting to hear what you have to say. I listened to you speak about two pivotal sessions in your life. First, when you were interning for UN SEPA, that's UNFPA, and the second was when you had to step down your pay grade because you wanted to do something that impacts Africa. So I would love you to explain to the students and give them advice on what should they do if they're on the verge of making similar decisions. What I know you said that putting yourself out there, we shouldn't be scared to take risks. What advice can you give students that probably are going to find themselves in the same situation you found yourself?
Thank you very
Hello,
much. Yes, I can hear you. Thanks, Dr. Teresa. And I'm just expressing how. Hello, can you hear me?
Yes, we can. Go ahead.
Okay, great. So I was just saying thank you. to Dr. Teresa and just expressing how inspired I am listening to the other speakers. Of course, my big sister, Dr. Christy, Dr. Deme, and other very renowned speakers. I was smiling listening to them. You may not have seen me because my camera is off, but we have so much in common. And I really want to put it out there to you students that I am very certain that a lot of the experiences you're going to go through in life are not exactly unique to you. There'll be some, of course, uniqueness to you, but there's so much you can learn from people who have been there before you so that you don't have to repeat the same mistakes and you have to be better than the people who were there before you because you're drawing on their very rich experiences. For me, that decision was tough, right? But I looked at the bigger picture. So what I'm bringing before you right now is big picture thinking. Don't make decisions because of the immediate benefits you will get now, but think about that decision in 5, 10 years from now. Will your decision put you on that platform you want to be in 5 years? Right? You could think that it's a small decision, I'm just going to do it. I mean, the immediate benefits now, and when we get to 5 years, we'll figure it out. But life, obviously, unfortunately, doesn't work like that. You have to be intentional. And I think all the speakers have hammered on this directly, indirectly, drawing from their personal experiences. You have to be very, 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 very intentional. What I like to ask myself a lot of times, I've talked about the skills part, but beyond the skills part, I think this is an important part as well to think about. There's building soft skills too. I mean, we all have our technical skills, we are health professionals, but then there's the soft skills. Are you able to communicate effectively? These skills that you even have to people who are the shapers of your future. People, you're in the room, and are you able to communicate that skills? You could think of that as building your communication expertise, right? You ask yourself, stand in front of the mirror, practice. What can I say? I mean, in our Nigerian term, your destiny helper. What can I say to my destiny helper in 2 minutes that will catch this person's interest? That will just be the game changer for myself. How can I describe myself in 3 minutes to ensure that this person picks interest, this person attention that I'm trying to get, I'm able to get it? Hello, I'm just checking if you can hear me and I can proceed, right?
Yes, ma'am, we can hear you.
Okay, great. So those are key areas that I think would be very important beyond the technical skills. Hello?
Yes, we can hear you.
Okay, sorry. Okay, can I proceed?
Yes, go ahead.
Right, thank you. So I was just talking about reflecting on some of the areas that Dr. Deme talked about. We, as medical professionals, as health professionals, you need more than that skill set to excel in the global landscape. For example, when I did finish my first master's, I thought, okay, but do I fully understand what applying health strategies mean in my space of work? Do I understand how that means in the broader scale? So I decided to take an MBA, an executive MBA. And then I started working on that. I graduated. Shortly after that, I thought, okay, beyond my MBA, what is the actual certification in the market that puts me at the forefront, that puts me in the top, say, 10% of people who have that skills, right? Because my personal conviction is I, as Faith, do not want to walk into a room and want my academic qualification to be my limitation. I actually have this written on in front of my mirror and I kept it there. Every time I get into my bathroom, I look at it. I might not be eligible for anything else, but my educational qualification will not stop me. So personally, I've put my cards on the table and I've told myself, what are the things, the qualification that I think that I need, and how that will steer me towards my destination or my final destination, however you may think about it, your career destination. And in addition to that, I also took a project management professional certification exam, PMP, which is quite popular. But I'm going back to communication skills. It's very, 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 very important. as we must have been told, as we would have heard, talent is not enough. What takes you from point A to point P is actually discipline. Yes, you're a skilled medical doctor. Yes, you are smart. But how do you apply all of that skill sets and the smartness? What keeps you on your toes and keeps you in check and continue to steer you forward is discipline, right? If you had read in my bio, I was the only Black African girl in the Global Burden of Disease Independent Advisory Committee in the United States in Seattle. I'm currently in Washington at the moment. And you walk into the room and people look at you, a room filled with white people, and you're the only Black girl. And you're not just Black, you're Nigerian. And you're not just Nigerian, you're Southern Nigerian. When you come out of that space and come out to the rest of the world, you see how very few of us from Southern Nigeria are out here. So it was such a thing, right? And then having me making the global presentation to Bill Gates himself, I stood in front of Bill Gates and he asked me a lot of questions about the work that we've done for the global burden of disease, specifically the TB. We had a TB consortium and we're looking at the overall GBD papers, which are close to like 20 or so, working through the trends over 20 years as well of TB and how countries are managing, especially how countries are faring in the African continent. And we finished that. I was asked to make the presentation. I was shocked. I was like, hey, small me, this Nigerian child from Port Harcourt, what do I know? But I saw that as an opportunity and I put my foot forward. The people who I sat with in my board are the ages of my grandparents, which I never saw, by the way. But these were people who had faith in me. They gave me space. And there's something very profound that Dr. Udeme mentioned about standing in front of kings and speaking in front of kings. It comes with a lot of preparation. You prepare yourself. Opportunity means preparedness. You prepare yourself so that when that opportunity comes, you take it. You are prepared for it. You are the one. You are no less than anybody else in the room. But it comes with a lot of self-discipline. It comes with sacrifice. It comes with blood, tears, sweat, all of it. You will have to pay the price. I know we live in a world currently where we are being told, oh, there's easy money, just do ABC and that's it. But you would also see that it pays to pay the price. It pays to take the journey. It pays to enjoy the process. It pays to go through the process, because as you go through each of the process comes refinement. You're being refined by fire. You know how gold is refined. It goes through a lot of refinement process, a lot of heating, preheating, reheating. But for every time you come out and excel through an experience, an additional layer is added to your life. An additional, I don't even have the words. I'm so passionate and so inspired, and I wish you can just see all of them in my head. But you are enough. You have everything it takes. I used to think I was disadvantaged just because of where I come from, because I was an orphan. My parents were late. Of course, there's no one that's going to pay my school fees in South Africa at the time. But life has a way of pushing you through that direction where you work towards. For example, if you continue to make bad decisions every day, you keep bad company, of course, that's the way you go, right? But then if you make a shift and shift towards the good, decisions, then of course the universe listens. But most importantly, and in alignment to what Dr. Udeme says, God sees the effort. He knows how to steer you towards where you're going. I'm just telling you that you are enough. You can do it. There are no limitations that you're seeing right now that cannot be surmounted. They are all surmountable. You just have to put your mind to it. There were times, and I got really emotional listening to some of the speakers. There were times when my mom had a stroke before she died. I pushed my first scholarship, by the way, from WITS, and I stayed back home in Nigeria for a whole year. And in my mind, I was like, oh, I've lost it all. I cannot do this. They're not going to consider me anymore. That opportunity is lost. But God knows how to keep you on that track. God knows how to ensure that you are there. God knows how to open doors that actually seem closed right now. You can do it. It can be done. Stay focused. Avoid the distraction. This is something I still tell myself right now. I'm in my final year of my PhD, and I have a full-time job, a crazy job that I travel 90% of the time. Sometimes I take my classes in the plane. But the most important thing is staying focused and knowing that where you are now doesn't define your whole existence. This is just a stepping stone. And I tell you with every conviction in me that if you stay focused, if you draw on the lessons of the people around you, this very beautiful platform that my big sister is putting together, if you leverage on this, there's nothing in this world, particularly in the career space, that you cannot surmount. Stay hungry, as I noted earlier. Every opportunity you get to learn. Be someone with multiple skill sets. Be someone with a versatility that is not common. Because again, in a world of a lot of commonalities and commonness, you want to find a uniqueness. What is your niche? Another thing that Dr. Demes said was he made sure he built his skills in that direction. One thing you're going to struggle with, which I did as well, and I think other speakers did, is finding your niche and deciding, okay, do I want to be a pediatrician? Do I want to be this? Do I want to have my skill sets focused on a certain area? But build the passion in that area. Allow yourself to be exposed to all of it, as much knowledge as you can gather. No knowledge is a waste, as my father used to say. But as you continue to do that, you begin to garner interest. I would not have believed that a girl raised in the barracks by parents who didn't have the opportunities that I had, and eventually I lost my only sister and a brother at some point, will be building the capacity of health ministers in the 55 African countries of Africa. I'm doing that right now. I have speakers who sometimes when I look at myself after my sessions, I'm like, oh, wait, I feel like I don't even deserve it. There's the imposter syndrome, which I think most of the speakers here would have felt at some point. I ask myself, how did I get here? Do I even deserve this? Who am I that God has looked upon me with favor? But it can't be you. You have the potential to be better than all of us who are speaking to you today. So don't lose faith. Don't lose that opportunity. Grab every opportunity you get. We are here to support you. Do not ever think that you are not enough. I'm repeating myself. You are enough. You have everything in case, and you can do all things through Christ who strengthens you. Thank you, and over.
Thank you so much, Ms. Fred. I think she can hear me. Thank you so much, Ms. Fred. Please, there's a follow-up question for you from a student.
Yes, please go ahead. I can hear you.
Okay, he or she wants to know, she wants to get many skills along, but doesn't know how to go about it. What practical approach to help out in terms of financial constraint, and how to even know the skills that are out there?
Okay. There are a lot of free, I call them more courses. I think the other speakers too can chime in. There are a lot of free courses out there on platforms like Coursera, on platforms. I could even share some links later. Even from schools like Harvard and MIT, there are certain links, which you would find that allows you access to a lot of free courses, right? So that can already bridge the gap of financial constraint. And in that case, I guess the only thing that that will have financial implications for you would be buying internet bundles to allow you to take these courses. But there is a whole lot of free courses available, and you can learn that. Let me give you a very short example, totally unrelated to my career, but as a growing, struggling girl in Port Harcourt at the time, trying to make ends meet, then I learned full makeup artistry on YouTube for free. I didn't have to go through any teacher. I didn't have to go through any of the big makeup brands, but I did that on YouTube for free. And by the time my scholarship came and I had to move to South Africa, that became a part-time job. During my master's, Saturdays and Sundays, there are weddings and occasions. I'll put my skills to use, and I was making some extra money to support myself, buy food, buy my books and etc. And in staying hungry as well, I just thought there's an experience I needed to share. While I was studying in South Africa, I finished, when I got into my internship with UNFPA, transitioned into an actual job. There was also another job that I had, right? Which it was difficult to lose at the time. So I had two crazy jobs. I'll do my morning 9 to 5 at my UNFPA office, then go to the other office and do 6 p.m. to 11 p.m. I didn't stay far from the other office, so it was safe. So I did all of that. It was crazy, it was hectic. But I would tell you that those are the things that have set me on the path that I am now. So there are free courses available, surf the internet, reduce the time you use for doom scrolling on social media, but use that time to even YouTube is free. There's so much you can learn, so much you can learn on YouTube, Coursera and EDX, so many other platforms that offer these free courses. And I think that should work. But I'm happy to take a follow-up question if you have one.
Thank you so
Okay.
much, Elizabeth. I know the person that asked the question have learned one or two things from you. Thank you.
Right. Thank you.
All right. Thank you, Miss C. Thank you so much. Thank you so much for sharing your depth of knowledge with us. And I know you really have to leave right now. And so I really want to thank you for being part of this webinar and thank you for sharing your experiences honestly with us. Thank you very much, ma'am. So
Thank you
please,
so much
I'll be
for having
asking.
me.
Yeah, you're
And
welcome.
bye-bye.
Thank you so much. So, bye-bye. Bye. So in 2 minutes, I would be asking two of our guest speakers, Dr. Ekripo, he's also my teacher, and Dr. Ekpene, who is also my teacher. I'll be asking them a practical question because many students may feel that clinical practice, academia, public health, data science will take a very separate paths. They may be right, they may be wrong. So, stars, can this be combined? And how do people leverage skills like from one field like clinical expertise or data analysis to succeed in another? For instance, Dr. Ekripo, you talked about, I know you were my nephrology teacher in internal medicine. You were my nephrology teacher in internal medicine, and you spoke so much about learning Python late, learning R late, learning data prediction software and modalities late. So how can people leverage and mix these skills? Hello? Hello, sir.
Yeah, I can hear you. Thank you. So it really depends on your interests. Everything is possible. I mean, Dr. Ekpene is a neurosurgeon, but he's gone to do a master's in clinical research, and you see him writing a lot of papers. I've done, I've done clinical work. I've done academia. I probably have up to 120 publications by now. I've been in industry, into the business of nephrology. I'm also a preacher. So all that is very possible. First of all, you will be a very good clinician when your research skills is good. I noticed a big difference in my clinical prowess when I went ahead to do a PhD in nephrology. You will be able to think more critically when you are by the patient's bedside. But remember that when you do clinical medicine, you are seeing patients one by one. If you really need to have bigger impact, you need to be able to do the research that will touch a lot of people. So that's where the research component comes in. That's where the kind of thing God sent is doing comes in, where you will be able to predict what is going to happen in the future. I'll give you an example. When I was in Saudi, the American multinational I was working with asked me if I could predict how many dialysis patients will be in Saudi Arabia by the year 2030. You know, they have a functional vision 2030, not like us that had vision 2020 and we were joking about it. So we had to sit down and use time series analysis techniques, and then using historical data of the number of dialysis patients they've had from 1996 till 2022 to be able to predict what it will look like up to 2030. And of course, with that data, they were able to start a community health intervention program. And as at the time I was leaving Saudi, they had already screened about 12,000 people for chronic kidney disease. The whole idea was catch them in stage 2 or stage 3 CKD and try to reverse or slow down progression to kidney failure so that it will reduce ultimately the cost of the amount of money the government was spending doing dialysis for their citizens. But you do that when there's data, unlike Nigeria where we don't have data. So currently, I'm the one handling kidney disease data for the whole of Nigeria, and Udeme Nelson helps me with that too. And we are now building a dialysis registry for Nigeria. We just got about 8,000 dialysis patients registered, and we are analyzing the data now so that we will be able to say something about what is happening to dialysis patients across the whole country, and which will also encourage other countries within sub-Saharan Africa to do something. Now, without data, you can't do that. And you need data skills to be able to keep the data, to capture the data. You need the technical IT skills to be able to get that data in place to be able to do those things. You can't do it without the data. So ultimately, you need to be able to combine these things if you want to be a very successful doctor. I'll also tell us this before I stop talking. If you want to leave Nigeria as a healthcare practitioner to go practice outside Nigeria, maybe in Europe or in North America, you need something extra to be able to catch the attention of these guys out here. You really need something extra, and it's not the Palo and jaundice that will help you. It will not help you. They will not be moved. Either you've really done a lot of publishing, or you've really done a lot of public health impactful projects like what GodSent is doing that you can reference, and with that it gives you an edge. If you're just coming with your empty CV that you finished school, to even get a matched in the US, you will sweat. You need to have something extra. So that's to tell us how competitive it is. So for the young people who like some mathematics, have some statistics skills, reach out to GodSent. He will tell you, he will teach you, he will tell you where to get the resources. Then you discipline yourself. It's really it takes a lot of discipline. You pay the price, you discipline yourself. In 2 or 3 years, where you will be, even you will be shocked. Thank you. I hope I was able to do justice to that question.
Thank you very much, sir. Thank you so much. Yes, you have. You have answered the question. So I'll leave my colleague Juana to take the next question.
Okay. Thank you very much, sir, for the answer you've given. Now I have another question from our chat box. This question will be going to Dr. Christie.
Yes,
The
go
question
ahead.
is, yes, how do I combine climbing my career with other aspects of life, like marriage?
Okay, thank you very much. The key is balance. It's important to find a balance. I always tell people, while you're trying to build a career, it is important to remember that you also have another part of your life to attend to. There is no magic wand, all right? It may not work the same for everyone, but it is good to always allow yourself to try to ensure that you're trying to build a family, you're trying to make sure you serve your community. So what that means is, so for people who are trying to, probably you're in your residency, you want to be doing your residency, or you have a job, please build on the resources you have. Do you have people, your family who live around? Ensure you try to work with them. Do you have parents? Ensure you make the best of your parents if they're alive. Yes, reach out to your parents. They would also be very willing to support you. So if it comes to, having to take care of family members and all of that. But also, very importantly, remember that you are not an island. You're not going to be working alone. The power of collaboration. Collaboration takes you to places where you would never get there alone. So I remember Faith talked about the soft skills of communication and the way to make sure that you actually develop the skills that make you able to relate with other professionals. It's important to know that apart from professionals, you will also relate with your community. I'm a grassroots person. Ensure that you make yourself available to your community and be also useful to them. I also want to reflect back on what Dr. Ubong Epene said. I think a lot of the things he said spoke to perseverance and resilience. We need to be able to know that if I'm going to be climbing in my career, I need to persevere, I need to be resilient, and I need to ensure that whatever I do, if it may not end there. Okay, so we need that resilience to we say something very important. What do you do and failure? You're to get lessons from them. The mere fact that you failed means that you have tried. So make sure that when you failed, you are not staying down. You move. Make sure that you make an attempt, try. As you're trying to move in your career, be flexible, ensure that you're not letting your life come to a standstill. Please make sure that if you fail, learn lessons from there and use that as fuel to get to the next level. Thank you. Hello? I hope I was heard.
Yes, we heard you. Yes, we heard you.
Okay, all right. Hello? Okay. Dr. Teresa? It's like we've lost them. Dr. Teresa?
Oh, thank you,
Yes,
Ma. I
ma.
think the
Please,
network threw us out for a moment. Thank you so much,
all
Ma.
right.
Yes.
All right.
Please,
Okay.
according to what Dr. Ekripo said, do not limit yourself to traditional medicine. So it's obvious that the healthcare landscape will constantly evolve with technology advances, policy shifts, and global health challenges. So, Dr. Godsent, please, how do you stay adaptable? What skills or mindset do you believe are essential for students to thrive in this dynamic environment? Please, in 2 minutes, just summarize that for us. Thank you.
All right, thank you. So let me answer this real quick before I jump out. Just like what we have heard, we need to stay focused, right? And focus is FOCUS, which means follow one course until success. I understand that a lot of us are multi-talented and we can do a lot of things, right? But focus entails that we follow a particular course until success is reached. And perseverance is everything. See, right now you're talking about going to tech, diversify, look beyond limitations. These things are just theory. When you start the practice, you're going to realize that they're not easy, as we have said. But like every speaker has said here today, perseverance and resilience is one thing that's going to get us to our destination. So there are times when, okay, like Miss Faith puts it, right? Perseverance in the face of adversity. So it's not working, but you have to keep going. It's not working, you have to keep going. That's the greatest test for success. What are the tools you need to learn? Because of course, medicine is evolving, and so you need to stay ahead of the trend. First, I'll say you have to start the trend before you now begin to talk about evolving. Because when you continue to learn, right, you begin to see gaps. And it's those gaps that now inform what you do next. So for example, I started learning data analytics, and then after data analytics, I went into data science and predictive modeling. And right now I'm taking a course in cloud computing, right? So because I'm seeing that there are a lot of gaps that needs to be filled, right? And so you have to stay ahead of those trends, but not all trends, because there are a lot of trends right now. Trust me, there's a lot of things, but you have to focus on the ones that align with the paths that you've chosen for yourself, right? And then again, like I said, I'm not going to come and tell you that these are the trends to follow, and these are not the trends to follow. No, I'm saying that by the time you start your journey, the knowledge you gain is going to open your eyes to the possibilities, and you're not going to be able to identify gaps. Those gaps are what you're going to upskill. So you learn more skills that will help you bridge those gaps and help you make more impact in your career. And before I jump out, I really want to say thank you so much to Dr. Udeme. Your everything you said resonated so well with me. I'm really so passionate about what you're doing here in Nigeria, all the way from Washington, DC. I sent you a connection request on LinkedIn. I'm hoping that you could accept that so that we can discuss. And then I'm also going to see how I can contribute my expertise to amplify the great work that you're doing. Thank you so much, everyone, for having me. I'm truly grateful.
Thank you so much for being part of us, Dr. Godson. Sorry, like Dr. Ekripo said, some of us are pluripotent. We are doing many things at the same time. It looks like there are distractions. So I would love this question in 2 minutes. I don't know if Dr. Ekpene is still online. Hello, sir.
Yeah, I'm still online.
Oh, okay, sir. So we would love to ask, are there particular parts of medicine in the chat box? Someone asked if there are particular parts of medicine or career opportunities in medicine that allow one to be part of public health and clinical medicine actively. Dr. Ekripo mentioned that you are into clinical research, and I know research is also a very important part of public health. So are there career opportunities in medicine that can allow one to be part of public health and clinical medicine actively? Thank you.
All right, thank you. Before I answer the question, I just want to, everything that has been said so far, most of the things that have been said so far by all the speakers has tended towards technology, tech in medicine and all that, and of course a bit of research. But I just want to say that as students, you must understand that not everybody will be into tech. Not everybody will be into as in fully. You need to have a focus first, have a background, have your focus should stem from an early decision about a clear pathway you want to take as a course of practice. And by that I mean you have to make up your mind first clearly. What am I interested in? What am I going to do? Am I interested in clinical medicine purely? Am I interested in tech? Am I interested in business? Whatever it is, you must have it early enough and determine and decide. Now, of course, you can marry all of them together, and I will talk about that shortly. So if your focus is to go into clinical practice, then you have to also decide, do I want to practice in Nigeria? Do I want to practice in the UK? Do I want to practice in the US? You have to also have it clear in your mind. The reason is that if you don't have it clear in your mind, you would lose a lot of time. If you want to practice in medicine, have it clear, okay, what do I want to do? Do I want to go into residency training? If I want to do clinical medicine and I want to go into residency training in Nigeria, you should start reading ahead to understand what it takes to go into residency training in Nigeria. Am I going to go into internal medicine? Am I going to surgical area of pediatrics? You have to clear your mind, ONG, or even public health, family medicine, and all of that. And then understudy, know what the requirements are. As a rule, most of them require that you write primaries. So if you're writing your primaries, decide early that, okay, I'm going to write my primaries after my youth service. So I start reading during my youth service. In my time, you could write primaries as a house officer. That's why I passed my primaries while doing house job. Primaries in surgery. So when you have a clear out mindset like that, then you are able to start early in your line of practice. So if you want to go to UK to practice, then decide, okay, I'm going to write BLAP early. I want to go into residency program. Of those aspects. Can you hear me? Hello?
We can hear you now, sir. We can
Okay,
hear
so
you now.
any of those aspects that you want to practice, you start early and write process. You can then think of other aspects. When I did my residency in research, masters in clinical research, the University of Liverpool, so that I could also increase or improve my clinical acumen as well as my research skills. And of course, you can do both. And to answer your question now, there is no specific specialty or subspecialty that you cannot research or do research in, that you cannot do some work in public health. You can still be involved in, and maybe you just do your master's in public health. If you also have public health interests, just take a master's in public health or clinical research or any area of interest that is related to research while still doing your core clinical work. And I like Dr. Kripo said, it's very important if you are involved in clinical research, it helps you in your clinical practice. Because as you're practicing, then you're able to think critically. You're able to see areas where you can make a difference. Then you can see where there are gaps. And then because you are research inclined, then you want to see how you can meet those gaps and mitigate the problems and see how you can help a lot of people. So it's very important that you have a clear in your mind. So you don't leave this place with everything in your mind. Oh, I want to, because you heard this person say, oh, tech. You've not finished your, remember, you still have your part one to your MBBCH to write. This is just to prime you on and, expand your mind on the things that are out there that you can avail yourself with. But most importantly, you must know that there are critical steps you have to meet and target you must set for yourself. And you must have a clearly cut out path. If you are going to do clinical medicine, know what the requirements are and make sure that you focus on those requirements and get started. Along the way, you can get other things, get all these texts, which are very, very useful. I can tell you for free that it is very useful. If you want to be relevant, like all the speakers have said, if you want to make it, if you want to even go out of this country, you must have added skills, both soft skills, clinical and non-clinical skills, which would help you be relevant. So I'm sure that all these, if you put them together into your practice, I'm sure that you will come out to be to have great prospects as both clinicians and researchers. Thank you.
Okay, thank you so much, Dr. Ekpene. You've answered the question spot on. We need to take care of critical steps, and then we add the icings on the cake, and then we move forward. So I would love to ask Dr. Akwawo if there are research training opportunities for undergrads in medical school. And my question from the chat box now.
Please take the question again.
Okay, Ma, please, are there research training opportunities for undergrads in medical school?
Okay, yeah, thank you very much. Before I go to that, let me just add to what Dr. Ekpene just said. Thank you, Dr. Ekpene, for bringing out how important it is to develop clinical skills and be a clinician. I must say that pride and in being a doctor is the most sacred. And there's nothing greater than being a doctor's doctor. So I would say that if you're in medical school, yes, and you would be very fulfilled if that's what you desire to do. Now to the question, are there research training opportunities for undergraduates? So the medical curriculum is very intensive. For you to graduate as an undergraduate, as a medical doctor, the 6 years of training does not even give you space to breathe, if you ask me. However, you can manage your time. So your best bet would be, can you look out for your lecturers or people who are actually into research, volunteer to work with them? And is there anybody whom you really want to be like? Please go to that person if the person is into research. But there are obviously certificates online. There are things you can do. There's so many courses and small trainings that can build your skills as in research. For example, there is a platform called the AuthorAid platform. The AuthorAid platform helps people who are writing, who are into writing. It strengthens your skills, it builds your skills in writing. You can ask questions there. It's a community. You get answers, and then you improve your writing skills. But for me, for people who are in undergraduates, I would really, really encourage you. Please go to your lecturers. Yes, Dr. Ekripo, I've seen that. Excellent. Go to your lecturers who are writing papers and work with them. That way you can get a one-on-one mentorship and you stand tall on their shoulders. You can go places. You need it so that when you're coming out, you want to be globally competitive. You want to go to that school. Dr. Ekpene went to that to do his master's in clinical research. You want to go to my school, the London school. You want to go to, wherever, Dr. Kripo's school, the Wits, University of Wits, you need to have shown evidence that you have actually done some research work, no matter how little. So please look out for those kind of opportunities. And then there's a lot to also, learn from online. You can identify those opportunities and also, apply yourself to it, and you'll be successful developing your research skills. For us in the Institute, we are doing a mentoring program. Right now, we have about 23 people who are actively involved in our mentoring program. We try to structure it. We've done a lot of informal mentoring for research, but we are doing a more structured thing now. And we are working on some papers, some systematic review papers, and some other, original research work. So please, those are all opportunities, and you're invited to join us. Thank you.
Thank you very much, Ma. Yeah, thank you very much, Ma. Please, the next question is for Dr. Ekpene. I know he has talked much about clinical practice. I just want to ask, how can those who love clinical practice remain sane, focused, fulfilled in the face of many challenges in the health system? Please, Dr. Ekpene, are you there?
Yes, I'm here.
Okay.
Well, the fact is that where we practice in Africa, and in particular in Nigeria, is fraught with lots of challenges. And one just has to find a way of circumventing some of those challenges. I want to start by saying this. First of all, you have to make up your mind that medical practice or health practice generally is a calling. It's a sacrifice. It's not something that you get into it and you suddenly become a millionaire or a billionaire. It's a process that, first of all, takes into consideration the humans that you're going to help. And let your passion be first driven by the fact that you want to serve and help humanity. That is what will help you to have this mindset of delayed gratification. Yes, everybody wants to practice where you have all that you need available. So you give in your best, you put in your best, and you also see the outcome. But when we look at our own setting, you don't have that luxury. So how do you navigate a way? First of all, you have to get the required training, and you get it wherever you can, even if it means traveling out to get that. And then secondly, have the mindset that that skill is to save life and to contribute to humanity. And when you have that mindset, you'll be able to at least tolerate the problems that we have. And then, of course, thirdly, learn to be innovative. Being innovative means that you have to, not everything that you would see in the books or you would see in the or videos as a state of practice in developed climes that you would have available to you. So you just have to innovate. When I finished practicing or training as a neurosurgeon and came back to Nigeria, being the pioneer neurosurgeon in Akwa Ibom State, I had virtually nothing. There was nothing on ground, not even, I would say, as a matter of jesting, not a spoon, nothing to work with. So it took a lot of sacrifice. I had to think out of the box to make sure that I could save life. Of course, I can tell you even today, I still have the option of leaving Nigeria. If I want to leave Nigeria right now to where I can have all that I need and then also have far more money I can never make in Nigeria, I can do that. But that's the mindset I had when I came back. But I decided, okay, If I go there, there may be many neurosurgeons. I won't even be so relevant. At best, I'll just receive salary, do a few work, and earn my salary. But I know that where I am now in Nigeria, I could impact lives that will be more fulfilling to me. Because it may not be so rewarding financially, but that joy that you have saved a life that would have died is enough to, spur you on. And that's what has spurred me on. And so what did I do? When I came, there was nothing. For 3 months, I wasn't able to operate. I was referring patients until it got to a point that I just said, what is this? Should I continue like this, or should I just leave this country and go and practice where I can be more relevant, get what I need to work with? So what did I do? The first set of tools I had to work with to save life, I had to buy with my own money and use it in the teaching hospital setting to save lives. And it took almost a year before the hospital could get me basic tools. So within that period, I had to be using the tools I bought with my own money to save lives. And when I look back and see that many people that their lives have saved, the children who are still alive today, because of that decision I took not to go away, but to try to stay and save life, then I have no regret whatsoever. Of course, it may not continue like this ad infinitum. But what I'm telling you is that as a doctor, somebody who decided to come into medicine, one mindset you must have is that it is a calling. And a calling comes with sacrifice. It's like somebody saying he's now a pastor. It comes with a lot of sacrifice, a calling. So also medicine is a calling. Yes, it is good to go and practice outside there. But also think of the fact that there will be people in Nigeria here who would need your services. So determine, first of all, let me practice medicine, clinical medicine, to save lives. And then later on, maybe as you are building on your capacity, as you get more skills, as you get more knowledge, acquire more skills, then of course you may have to move on. In life, there is nothing that is constant. I'm not going to tell you that I will always be in Nigeria till my old age. And I can't even encourage you to do that. But what I'm trying to say is that understand the concept of medicine. It's a calling. And being a calling determines that this is my country. I'm going to do my very best. I just say one thing before I stop talking. When I traveled to the north some months ago, and I met one Lebanese, no, one Indian, and we were talking. It was a conference, so we're having dinner, we're talking, and then he told me, that he has been in Nigeria for over 30 years. All of the things he has achieved has been in Nigeria. So he decided to be a Nigerian. He has refused to go back to his country and is going to die in Nigeria and be buried as a Nigerian. I was looking at this man, look, trying to run away from this country. And you want, as an Indian, you want to die. He said why he wants to do that is because Nigeria has given him so much. He came to Nigeria with nothing. He was pushing truck in the streets of Kano as an Indian until gradually things change over time. And so because of that, he thinks that now it's a giving back time. That man was almost 70 years when I saw him. He said he's going to die in Nigeria. So I learned something from there. Yes, high tech is good. All these things are very good. Leaving the country is good. I cannot stop anybody or dissuade anybody from doing that. But all I'm trying to say here is that clinical medicine is something you have chosen as a starting point. Make up your mind that you're going to give back to the society as much as you can. Build on that with all that we've talked about here. And so that you be a more uniform or complete person. So that when you go out there to talk or practice, people can see a difference. That this one is a doctor with a conscience, doctor who has been good all around. And I think it will make a whole lot of difference than just being a technology doctor without any clinical acumen or base. That's my point of view anywhere. People may have different or divergent view. Thank you so much.
Thank you so much, Dr. Ekpene, and thank you all for participating. I'll hand it over to our moderator.
Thank you so much. Can you hear me? I hope
Yes, we can hear you.
Oh, perfect. Thank you so much to our panelists. I'm so grateful. I have learned a lot. I've gotten people messaging me already to say, wow, this is really, truly impactful, and asking for recordings. So I just want to say thank you so much. Thank you, Dr. Ekpene. Thank you, Dr. Kripo. Some of our panelists that have left, I'm so grateful. Dr. Christy, thank you so much for this session. I'm just going to give a roundup of what we have learned so far. The reason for this session, the reason why we conceptualized this session at the Institute, as I said earlier, was because we wanted our young people to start thinking about their future while in school, not necessarily to give a particular career path or put a particular career path in your mind, but we try to represent, a clinical, someone that's clinical minded, public health, and someone that is in the development and global health space, in tech, in academia, to try to give a view of how to start preparing, how to start thinking about your career, and some push on drive and passion. So today, this session has highlighted very valuable lessons for me, and I hope very valuable lessons for you as well. Valuable lessons for career development, for personal growth. We've had to start early in your journey, right? Dr. Ekpene emphasized starting early because he said he started thinking about this or started having this vision when he was in JS3, and he pursued it. We've learned from Ms. Nifi to stay hungry, to be passionate. Things will not come to you just lying down or sitting down. I mean, things will come to you. You're in the medical field. You will live a normal, regular life. Just eat, and that's it. That's all you can do. But when there is so much more you can do, so you should pursue your unique vision and avoid simply following the crowd. Dr. Gossent emphasized on not allowing fear to hold you back, each day doing something better. So striving every day to take an action such that you will impact your future. And Dr. Kupo emphasized on the fact that having a humble beginning should not limit you, right? If you keep pushing, you believe in God, you strive further, you will succeed. You'll get to where you want to go to, striving every day to be important. And he emphasized that money is important. So while you're pursuing your dreams, also pursue dreams that will put food on your table. And Dr. Chrissy rounded it off with saying that to strive for a balance. One thing I really picked from her session was striving for a balance between having a clear focus, putting your mind on something, and then also allowing, would I say, the universe, God, to lead you, to looking for opportunities and having those aha moments and saying, okay, although this is exactly what I wanted to do, but there is this opportunity that is closer to what I want to do, and then going towards there. So I'm very, very happy about this session, and I hope we have fulfilled everything that I know we have fulfilled everything that we wanted to do. Please, so I know that some people may still have some questions or comments. I had initially put the Institute's email there. Please, you can send it to us. Also, if you would want to be connected with any of the speakers today and you can't find them on LinkedIn, you can't find where to message them, please just send us an email and we would ask them if they are willing to connect with you. So thank you so much. Thank you, sir. Thank you, Dr. Ekpene. Thank you, Dr. Kupo. Thank you, Dr. Christy. Very, very grateful for your participation. And thank you, our beautiful guests. I hope I was heard.
What of Miss Faith? Where is she?
No, what did you say?
I didn't see you. I didn't see Miss Faith again.
Oh, yes, she left. She had to leave earlier. She had a meeting about 20
Okay,
minutes.
all right.
Yes.
Excellent. Excellent.
So, thank you and have a beautiful weekend and happy holidays. Bye-bye.
Thank you so much, Dr. Tracy.
Bye.
Everyone. Bye.
Thank you, everyone.
Thank you so much, Dr. Victory, for
Thank you.
hosting this
Yeah,
session for
for
us.
anchoring.
Sorry, ma'am, please 1 minute. Let me just leave this meeting.